Hey everyone, this is Eric Franklin with the Garrison Public Affairs Office, and on this week's episode, we're talking pregnancy centering on the Great Big Podcast.
Hey everyone, Specialist Garrett Dackle with 11th Signal Brigade here. Today we have two very special guests. I would introduce them, but I kind of want you to hear their voices first, so would you all mind introducing yourselves?
Good afternoon. This is Molly Hunter. I am the Centering Pregnancy Coordinator over at Carl R. Darnell Army Medical Center.
And I'm Kristen Leftridge. I am a certified nurse midwife, also at Darnell. And for a long time, I was actually the centering coordinator until I realized I couldn't wear that many hats. And so we hired my wonderful friend Molly to come and run the program. And I'm now kind of the provider liaison.
Okay. Can you guys... First, Miss Molly, we'll start with you. Tell us a little bit about what led you to here to the Great Place and just a little bit about yourself.
So we came to Texas from the Midwest. We were looking to maybe retire here. The weather's nicer. We were looking for a new start. And I really wanted to get back to the military community. I'm a former Army nurse. And when I was looking for a job, this one popped up, and I really didn't know anything about centering. So I did some research, and as I looked at it, to me, it was a no-brainer. It's like, of course, why are we not doing this all over the world? It's perfect. Why would we not? And so I applied for the job, and thankfully I got it. And 4 years later, here I am.
Okay. And what brought you to Central Texas?
So
the Great Place.
The Great Place. So I've been here for 17 years.
Okay.
My children have literally grown up here. They were 1 and 3 when we moved here. And so this has been their whole life. We came here from Houston. We lived in Houston for about 4 years after moving from Pennsylvania. I finished my master's degree in Philadelphia. My husband is from Texas, and he really wanted to come back home.
Okay.
So our goal was actually to go a little bit either farther south or farther west, and we just sort of landed in Houston for a bunch of different reasons, family and so forth. There was a great job waiting for me in Houston, and so we took that. We lived there for a few years. But the traffic was kind of horrific.
Yes.
I love Houston. I love so much about Houston, but that traffic was just murder. And so
yes,
it was too much. And I had a friend in that same practice where I worked, down in the medical center in Houston. And she took a job up here the year before me. And she kept saying, they're going to have an opening. They're going to have an opening. Please apply for this opening. And so the minute the job opened, I threw my resume in, and here I am. And there's no traffic. And I will tell you, for the first probably 3 months we lived here, I kept looking for the traffic report on the morning news, and I couldn't find it. Where's the traffic report? There's no traffic report. I mean,
unless you're going through the front gate.
Correct.
Yeah.
Yes, that's the only traffic report you need. So we've been here for a really, really long time. I love it here.
Okay.
Fantastic.
So explain to us what the centering pregnancy is.
So centering pregnancy is a healthcare model. It's not classes. It's a innovative way for pregnant patients to receive their prenatal care.
Mm-hmm.
It's in a group setting. So what that means is, instead of them coming to the clinic and having a one-to-one 20-minute appointment with a provider, they actually meet in a group with 8 to 12 people that are due about the same time that they are.
Mm-hmm.
Yes, it's awesome. Some people are like, what? I have to meet with that many other people?
Yeah.
But the beauty of it is it normalizes pregnancy.
Okay.
Because pregnancy is not a disease. It's not a condition. It's how would you say, Kristen?
I know well, actually, I would probably call it a condition, only in the sense that it's a normal condition of
being
of being an adult,
part of life. It's a really special time in a family's life. And so by bringing these people together and these families together, they are empowered through this healthcare model to take control of their own healthcare. They also build a support network, and especially in this military community, we all know that the military provides extra challenges to families, and especially during this time frame, because a lot of their spouses may be deployed or they're soldiers themselves. We have a lot of pregnant soldiers. And so what centering does is it brings them together. It helps them realize that pregnancy is normal and that they can relate to each other. They can learn together. The sessions are actually 2 hours. So they still get their one-on-one time with the provider where they can ask their personal private questions and they can get their measurements and listen to the baby's heartbeat. But then they come together as a group, and instead of having to worry about asking their questions in rapid fire because they only have that 20 minutes with their provider, they have that 2 hours to really explore those conversations and learn from each other and learn from the provider. And maybe we have a guest speaker at that session for that topic. So then they can learn from that subject matter expert. So not only are they getting quality information, but they're able to actively interact because we use facilitative learning. So it's not a class, it's their healthcare. They are actively participating in that learning process. It's not us just standing up there and telling them, you should eat this or you should do that.
The toughest part of COVID-19, hopefully behind us. I know for the past 3 years, you guys haven't been able to have the class. So why was it important to get the relaunch here later this month?
So it's been almost exactly 3 years to the day. We stopped centering due to COVID on March 20th of 2020. So literally almost 3 years to the
really
day.
exactly 3
Wow.
years.
Yeah,
Yes,
that is crazy.
Yeah.
It is crazy. So we felt that at this time, it's safe to resume group care, and our patients really need it, especially because after having COVID and patients having to deliver their babies under all those COVID restrictions during those 3 years, they really need that community back.
And did you see a significant change from pre-COVID, during COVID, and now getting into post-COVID? Have you seen that significant impact that the centering program has?
So the impacts that we see with centering is it decreases preterm deliveries by 35 to 50%. It improves breastfeeding outcomes. And even if a patient does, say, have a preterm delivery, their babies tend to weigh more, up to a pound more, than if they hadn't participated in centering. So that means better outcomes.
Right.
We also see that babies are appropriate for gestational age, and that's kind of big fancy words, but let's say a patient is diabetic, they tend to have larger babies that are bigger than maybe what they should be for how far along they are in their pregnancy. With centering, they tend to be appropriately sized, so they're not big. And what that means is down the road, when that baby is an adult, they have less health complications down the road. So that is enormous.
How long has the centering pregnancy, how long has this been a practice or a method of care, healthcare?
I'm going to let Kristen answer that.
Okay. I think centering actually, I couldn't pull out an exact date for you, but I'm going to say probably around very late 90s, early 2000s. We started centering here in 2008.
Okay.
I had been here already 2 years, and then, the topic came up among some of our leadership. We all went off to training, and then we initiated the program at that time. And we did it at first as a research study in conjunction with a group out of San Antonio. And we had a research nurse who, she kind of belonged to San Antonio, but she sat up here. And so she ran did a lot of what Molly is doing now.
Yeah.
With putting people in groups, making sure we had all the data, making sure people were contacted appropriately and so on. And then she was phased out as the study came to an end. We had one other midwife who is military, and she actually has PCS, and she's back now to us as our chief nursing officer. Colonel Amanda Forrestal, and she's fantastic. We love her. So she ran the study as we were phasing it out. And when she first PCS'd out of here, she said, I need someone to take this over. And I just love centering for so many reasons. All the reasons that Molly mentioned. I just think it's an amazing program and such a great thing to offer our patients. So I took it over and I ran it until 16. And that was about the time that I realized I had too many hats on and I couldn't do both jobs full time well. And I'm all about, doing my job as close to perfect as I can. And I really love what I do. And so I want to do the very best that I can. And I couldn't do both things. So we put it on hold for a little while. Molly stepped in around that time and we had it running until COVID hit us. One thing I will say is that in addition to some of these longer term outcomes on the short term, what we have found in labor and delivery is that we have fewer women showing up for common pregnancy complaints. My back hurts. I've been vomiting. I have had these weird nosebleeds, that kind of stuff. We have way fewer people showing up to triage with these complaints because it's been normalized for them. Your back is going to hurt. And this is what I say to my patients. I know I'm a little bit flippant sometimes and I'm kind of jokey, but I will say, there's an entire human inside your body that doesn't always feel the greatest. A lot of times it's amazing, but sometimes they're a little bit uncomfortable and you just have to kind of roll with that and figure out what your comfort measures are going to be. When they hear it from each other, instead of hearing it only from me, it really does normalize it and kind of bring it down to a level of, okay, this is actually what's supposed to happen because she feels it. This person over here feels it. I'm feeling it. It's probably fine. So we have way fewer people showing up to triage. And we have, while the stress level has not really changed according to the research, the stresses are still going to be the same. They're still going to be there. The way those stresses are managed is much better. It's much healthier, much more efficient. There's a lot less self-medicating in various ways. And these pregnant patients are reaching out to each other instead of coming in constantly or worrying. They're calling a friend and saying, hey, did you have this? Oh, okay. That's probably fine. What did you do for it? And they have those extramural conversations in addition to having those same kinds of conversations within the group setting. And you can't find that anywhere else. They don't have that chance in an exam room. And one of the things that I have found after all the many years I've been here is that because Fort Hood is so big, there are so many people here, it's so easy to be lonely and so easy to get lost. And when I just had a conversation the other day with someone whose husband's deployed, it's her second baby, and she needs some help when she has this one who's due quite soon. And she was just boo-hooing. She was so stressed out about it. She had no one to watch her toddler. Her husband can't come home. Her family's far away. And she kept saying, what am I going to do? What will I do? And I tried to help her come up with solutions, but there's only so much that I can do.
Yeah.
I'm not going to her house. I would love to go to her house, but I can't do that. And so when you have a group setting where they know each other, they can come to each other. And it's amazing to watch. I just love it. So.
The other nice thing too is we encourage the spouses to come or partners, whatever their support system is. And by them participating, they also learn how to be supportive to their partner. And it's amazing to see that light bulb go off in their eyes. And we had an example. He was sitting in the group and he made a comment, and one of the ladies across the room literally leaned forward in her chair and was like, now listen here. And at the end of the session, he turned to her and he's like, I want to thank you because I thought she was just being whiny.
Yeah.
And now I understand way better that I need to be supportive. I need to be there. And it was just this big aha moment. And they need that sometimes. And if they're in a exam room one-on-one with their provider, they're never going to have that because they're not going to take it the same way if a provider says it to them.
Right.
And a provider may not say that to them because of the professional relationship.
And especially in that tone too.
Yeah.
Exactly. And she
Okay, I
just
might.
laid it out. Well, Kristen will.
God bless you for doing that because getting it
Kristen
across.
will. And a lot of our providers would. But yeah, I mean, the support that's there is just amazing. And I could just tell you stories and stories
Oh my
and
gosh,
stories.
So many.
And it just warms my heart because they don't have that if they're not in centering.
Yeah.
And centering's used, all over the world. It's not just for military sites, but it's especially important in military sites because, like we said earlier, there's just extra stressors that our military families have to deal with. Deployments, even just training when they're just going out to the field.
Yeah.
Be gone for months at a time just in the field.
Yeah.
Exactly.
So, and you don't know when, like
Yeah.
sometimes they don't tell us when
Right.
Yeah.
Exactly.
until
Day
like maybe a
before.
week. Yeah.
Yeah.
If we're lucky, a week.
Yeah.
Right.
Pack your stuff.
And the
go.
soldiers,
Right.
worrying about, where am I going to breastfeed? How am I going to breastfeed? What am I going to do? How am I going to pass my ACFT? All those things. And, thankfully, a lot of those things are improving with time,
Right.
but it's way different than when I was in.
Oh yeah.
I've seen some improvements firsthand. I used to work with Corporal Pearl, one of our co-hosts. She's out for the time being, but she actually at our unit level was advocating for like a breastfeeding space, and eventually got it. And I think part of it, I don't know if, because I think that was during COVID, so I don't think centering was active, but I do think, I mean, if she were there, then she would definitely be like, hey, I advocated at my unit, like this is how I did it. And here's those tools that you could use. And being in that group setting, I'm sure that would help a lot of maybe, the other pregnant soldiers or maybe other pregnant spouses in their own workplaces.
Well, and the nice thing about centering is there's no rank.
Right.
So in one group, we had a soldier who was actually a commander. And she took a lot of what she learned in centering back to her unit and implemented it. Her husband was also a commander, and he learned a ton. And so when he went back, he's like, okay, any of my pregnant soldiers or spouses of pregnant spouses, I now know way more, and I can support and advocate for them. So it really improves patient outcomes. It improves readiness. Everybody's all about readiness. But if you have a happy, healthy soldier, happy, healthy family, they're going to be more ready to do their job as an Army soldier.
Exactly.
How does someone get involved? How will someone sign up if they want to be a part of the centering pregnancy?
So typically what we do is when the pregnant person calls up and says, hey, I'm pregnant, I need to establish care with your clinic, they'll do an intake interview with one of our nursing team, and the nurses will say, hey, we've got this option for your prenatal care. Are you interested? Let me describe it for you. And if they say yes, then there's actually a form they can fill out that will make its way back to Molly. And then she will contact them and put them in the appropriate group if they're a good candidate for centering. There are some folks who are not good candidates, but it's not that many people.
Okay.
Really, most people are good candidates for centering. And then when they come in for the initial visit with a provider, then we also discuss it with them at that time. Hey, we've got this program. Would you be interested? Do you have questions and so forth? And describe it. And if they have not yet filled out that form, then we can have them do it at that visit. So we tend to divide centering into halves of the month as far as due dates go. So when we get started again in a couple of weeks, we're going to have the first half of September, the 1st through the 15th, and then 16 through 30 of September, those due dates. So they're clustered together. They're all due about the same time.
Okay.
So they're going through the same stuff at the same time. The conversations are going to be the same. And I will say, this is a bit of an aside, but I will say on the provider end of it, it's so nice to not have to say the same thing 9 times in a row during your clinic day. You can say it once and 9 people hear you.
Yeah.
It's fabulous. So that's also a benefit to us, that it does, make that conversation a whole lot easier and, far less repetitive. So once they fill out the form, it will go to Molly, and then she figures out, which group they're going to be in, if they're appropriate or not. And they may have an additional individual clinic visit before they get into the group, depending on the timing. But once they're in a group, that's it. That's their prenatal care. They are provided with all of their dates up front. So here's all your appointments. Now, ultrasounds will happen the same way they would in individual care. It's a separate visit. It doesn't come with centering. It's just a separate normal visit, the way we would do it for anybody. But everything else happens in the group setting. And so once those dates are established, we provide them that little handout. They can put it in their phone. They put it in their planner. And then they know when all their appointments will be. And there's even a reunion at the end. And so after the babies are born, they come back about a month or so later. We get to meet the babies and we take pictures and so forth. So it really is like the complete care of the pregnancy. And it starts very early, 16-ish weeks, and then it goes all the way through the end. So all they have to do is say that they are interested, tell a nurse, tell a provider, and we will get them to the right place.
So just a little extra on that. You have to be a patient in the Women's Health Center. So if you're a patient of the Family Medicine Residency Clinic, they currently do not offer centering pregnancy. So if it's something that someone really wants to participate in, then they need to request that their care is in the Women's Health Center. And even if you're a family medicine patient, you can still get your obstetrical care in the Women's Health Center. You just have to request that when you find out that they're pregnant. Now, the forms, let's say you don't get it through the secure messaging from that first nurse intake phone call. We have them at the desk. They're all over the clinic. They're pretty much everywhere. You can pick them up. It's best to just go ahead and fill it out right then and there and hand it right back in. They can hand it back in to anybody at any of the desks, to any of the staff. They can bring it directly to me if they like. If they have more questions, they can send it back, take a picture of it, send it back through secure messaging, or my email is even on the form. They can take a picture of it and then send it back to my email. It is not difficult at all.
Okay. Well, I don't have anything else. You don't have anything else.
I don't have anything else. I did want to say thank you both for coming in today, though.
Yes.
And talking about it.
Can I add just one thing real
Absolutely.
quick
Yes.
that just occurred to me when you mentioned about centering being the right fit? Occasionally, I'll talk to someone and say, "Hey, would you be interested in doing this? What do you think?" And I'm an introvert. I will say that all day long, and so I'll get a patient who will say, "Oh, I'm kind of shy. I don't really like people." And I will tell them, you don't have to say a word if you don't want to. You can sit there and absorb all the information. You don't have to contribute at all. And I have had patients, here and there that I thought, man, she's not really enjoying this at all. She doesn't really participate. And at the end, this happens every time I have someone like that. At the end, this is the best thing I could have possibly done for myself. Thank you so much. This is great. And they're just so suddenly effusive. They've got all these, words of praise for centering and how much they loved it. And every time it happens, I'm like, okay, yeah, I didn't think you liked it, but sure, you bet. I'm so glad you got so much out of it. So for those who are introverted, it is not a no-go. You can sit there and you don't have to say anything.
Okay.
There's always going to be somebody who's going to be like the extrovert and like, the party planner and the group leader. There's always going to be someone who has that kind of energy.
Yeah.
And they can learn from you just as you can learn from them. So it really is good for just about anybody.
And we have fun.
We do have so much fun.
Well, that's
We
the
have so
important
much
part.
fun.
That's
Yeah.
right.
We really
Absolutely.
do. We play music and we do games and we do a lot of interactive things and we just have a good
I love
time.
it.
And some of our patients we keep in touch with. I have a patient from 4 years ago. She still sends me pictures. We talk on Facebook now after the fact that she's no longer my patient, but Kristen's got people that
I
she's
do.
still in touch with from
I sure do. From years ago.
Years.
Yeah. Yeah. Literally years.
And some of the group members are still in touch with each other after 10, 12 years.
Yep. Yeah. They found their people. They found their friends.
Yeah. They found their tribe.
Well, you hear that? Go centering. Go check it out.
Yeah, it seems like it's an amazing thing. And the next class starts what day now?
It'll be Wednesday, the 22nd of March, and that'll be for the early September due dates. So if you're due between the 1st and the 15th of September, really anytime in September, get your centering interest form in as soon as possible because we've made those placements and we can only accept 12 at the most. So once it's full, it's full. We do put people on a waiting list. So sometimes people will PCS, and then we can bring people in, but it's best to get your interest form in as soon as possible.
Okay. And again, thank you guys for coming out, and we look forward to hearing more about the centering program. Thank you.
Awesome. Thank you.
Thank you.
Thank you.
Let your voice be heard at BOSS.
What's BOSS?
BOSS stands for Better Opportunities for Single Soldiers and serves the single service member community, active, guard, and reserve, as well as single parents, geographical bachelors, all U.S. military service branches, and foreign service members assigned to the installation. The BOSS program is based on quality of life, community service, and recreation and leisure. As a member of BOSS, have a voice in how you live, how you spend your leisure time, and how you support the community around you. BOSS membership and the program's available leadership and project management roles also will enhance your promotion packets. For more information about how you can become a BOSS member, visit our website at hood.armymwr.com.
If I was expecting another child, I would definitely want to find a program that's unique like this, that would help establish a better understanding for not only my spouse or the mother, but for me, because when they talk, it's like the men can go too, and it's like I think that's important that the fathers understand what's going on and they understand everything, and they're able to sit there and be in those classes with them
And have the conversation with their spouse or significant other.
Yeah. And especially that part, to be able to hear it and have other spouses, it's like, yes, that's exactly what goes on with us.
Yeah.
So I think it's very important.
And not even just their spouse, but other people that are there. So
I think having that collective, having that shared collective is important to people.
100%.
So this week, March is it's the middle of March already. I mean, not the middle. I guess this is the middle of March, isn't it? Second week.
Yeah, it's kind of the middle. We'll call it the middle.
We'll call it the middle. So, March is chugging along. Next thing we know, it's March 20th. And then it's my God. Oh, March Madness is starting, coming up here shortly. So that's going to be great times. I can't wait.
Do you have a favorite team?
I do not.
No?
I do not. I'm really not a big March Madness fan. I watch it. I think because here's why I don't like March Madness, because I had to cover March Madness and it was a headache and I was very exhausted afterwards. Yeah. So I just said, you know what? That's it for me. I'm not doing this anymore.
You had your fill and you're like, I'm done.
Front row seats. And I was just like, that's it. I'm done.
Oh, front row seats though.
But I was working like the entire time.
Yeah.
I was being a cameraman, did not like it.
That's fair.
Do not recommend. No. But outside of that, I don't think we have a lot of stuff coming. Well, there's a lot of stuff coming up in the month of March. I know earlier this week, MWR gave away, I think it was 1,100 tickets to NASCAR, and that's coming up on the 26th. I think I got my ticket.
Did you?
I want to say I asked them to reserve it. I got to go check my inbox to see if they saved me one. Formula One track down in Austin is hosting a NASCAR event on the 26th, and I think that would be pretty cool to go check out for a traveling soldier.
I think it's cool.
Yeah, so we'll see if we can get in there. Do you have any plans going on for this week?
So, not this week, but next week, I'll be taking a trip up to Dallas, and I got a couple recommendations from Sam and Blair from Traveling Soldier. So I'm heading up there for the weekend and going to check out a few things. They highly recommended the farmers market.
Oh, yes.
So I'm looking forward to that.
Yes. That's always a good thing.
Yes.
All right. Well, we like to thank you guys for listening to the podcast, and we hope you enjoyed it just as much as we enjoyed making it for you. And we will talk at you next time.
See y'all later.
Bye.
This podcast is a U.S. Army Garrison Fort Hood and Fort Hood Public Affairs production. The show's theme music is written and produced by Delicious All Stars. All our music is obtained through Filter by Song Trader. Have a question or want to share some insights with us? Email us at forthoodpao@gmail.com. You can follow us on Facebook, Instagram, and Twitter at USAG Fort Hood. And as always, be sure to leave a review and subscribe wherever you listen to podcasts.